Well, cleft lip and palate are conditions that affect the face during development, and it's actually the most common of the birth-related facial anomalies. 1 in every 1,000 births involves a cleft lip and palate, and cleft palate alone is maybe about 1 in every 2,000 births. Most of our surgery, we tend to send home that day. The cleft palate, we always keep them overnight because they have to feed properly. If we have to do the bone graft for the teeth, they tend to stay overnight because we need to make sure they're comfortable walking after harvesting bone from their hip. We're hoping not more than a night for any of those surgical procedures, but we won't send a child home if they're not feeding well or if they're in a lot of pain. Cleft repair requires so many specialists, so the first thing we do when we see a family is we introduce them to all of the various members of our team that will be working with them from birth until high school graduation. We'll be introducing the family to speech and feeding. We'll be introducing them to ear, nose, and throat. We'll introduce them to the orthodontics team because they're the ones who are going to help us mold the gum line, and the dental team who works with orthodontics. We'll introduce them also to our psychologist and social worker who will help them to coordinate a lot of these activities. For those children who have a cleft palate, the repair is done at about 11 to 12 months of age. The more we can allow the face to grow without causing additional scarring, the better development of the face will be. If we wait much beyond a year, as speech develops, they won't have the mechanism to develop the words properly. As the child gets to be about 3 years of age, they're able to recite phrases, and we can get a good idea of where they are leaking or not leaking air to see if a secondary correction is needed. After about age 8, our dental and orthodontic team will continue to work to get the teeth aligned properly. And now we're ready to do secondary lip and nose surgery so that we get the child looking as normal as possible when they meet their friends at school. Between 16 and 18, we can actually correct the nasal bones, put them in the right place, and not have to worry about impairing facial growth. But oftentimes, because we've stretched the lip and it gets thin, we can actually make that a little plumper by using fat and other tissues from elsewhere in the body and implanting that in the upper lip so it's as normal a form as we can give. When families come to our clinic, we give them a timeline of when things are anticipated to be done, and we try to stick to that timeline so there aren't unanticipated surgical procedures. I always recommend that no matter where a family goes, they look to make sure that their team is certified by the American Cleft Palate Association. Lurie prides itself on its team, and we're recognized by the American Cleft Palate Association for that assembly of the proper team members in orthodontics, dentistry, plastic surgery, otolaryngology, social services, psychology, genetics, and executing things on a recommended timeline.